Doordarshan Kendra Imphal na sandok chaba mipum khuding hakchang phana na da yektana leinabagi pandamda paring naina sandok chaba thoram HAKSHELGI PAOJEL yengbiriba mayam pumna makpu ahanba maktada taramna okchari khurumjari ngasigi HAKSHELGI PAOJEL da thamjariba hiramdi breast cancer hiramasi matangda khananabagi damakta ekhoigi studio da lengshinduna leibiriba expert mayamda sak khanghanjage Dr. T. Kannan, Senior Consultant, Medical Oncology, American Oncology Institute at Babina Speciality Hospital, Jail Road, Sajiwa. Welcome, Doctor. Thank you so much for being here. I really appreciate your time. Loina na ngasi ki thoram asi American Oncology Institute at Babina Speciality Hospital na sponsor tawiba adugumlaba thoram amani ngasi ki thoram asiga hiram asiga mari leinana adomna hangbining ba wahang sing akoigi adomgi television gi screen da ubiriba phone number da call tawiraktuna wahang hangbi ba yagane. Doctor, to begin with, Benoted Oncology is a branch of medicine that deals with prevention, treatment, and diagnosis of cancer. So, what is actually the term medical oncology mean? What are the types of oncology? Let's discuss in brief.
Yeah. Well, cancer treatment could be accomplished by different modalities of treatment. It could be surgery, or radiation, or medical oncology specifically would mean treatment with chemicals or drugs, not alone just confined to the drugs, but also the hormone and their products, some of the biological products like your antibodies, monoclonal antibodies, that kind of all these things comprehensively would mean treatment by medical oncology.
Thank you so much. So, Doctor, let's go a little in brief about the other types of oncology.
Like other treatments, and basically if you do historically or chronologically, if you see, the essential treatment has been surgery from time old practice.
Yes.
And then followed surgery means removal of the cancerous part. That was the practice right from the beginning, which still continues. And the second option will be, that has been also in practice, has been radiation, treatment with radiation. And the third and the newer version was the medical oncology. I am not saying that medical oncology did not exist earlier times. It was actually practiced by some of the surgeons as well as the radiation oncologists as well. Now only it has recently grown, and then a separate subspecialty like medical oncology has come into practice to treat the cancer diseases.
Thanks for the explanation. And Doctor, next I would like to know about the aspects of breast cancer, the general aspects of breast cancer. Let's please explain about it.
Yeah, we all know, and then we endorse, and we realize that breast is a very important organ, perhaps the most important organ for a female or a feminine gender.
Very true.
In terms of femininity and also the motherhood. So, such an important organ. Well, it is very unfortunate that cancers do occur. Unfortunately, in the female gender, breast cancer seems to be the #1 cause of cancer among the female cancers. Well, some time back, it was the cervical cancer or the womb cancer that was #1 cancer among the females. Now, the trend is changing. There is a transition, like the breast cancer is trying to overtake the cervical cancers. Now, the breast cancer is trying to become #1 in majority of the states, and even among the developing nations, it is becoming number one among the ranking of the female breast cancers.
Okay. So, sir, what can be the reason for this? Prior to this, the womb cancer, cervical cancer was in the top list, and then this breast cancer comes upon this cervical cancer. Breast cancer is now on the top ranking.
Yeah.
Doctor, what can actually be the reason for this? Can this be the change of lifestyle or genetic factor or the diets, the foods we eat?
Yes.
What can be the reason for this?
I would say the complexity that you just mentioned could be entirely be the cause for one decline and the other one raising. Cervical cancers, like it is on the decline because of the improvement in the treatment technologies in the medical field. One. The breast cancer is on the increase due to various reasons, like it could be essentially lifestyle, basically lifestyle, recognition of the family history, the first degree, second degree and closer degree relations having the breast cancers and their spread of the breast cancer through the genetic means. That is one reason. The other thing I just mentioned was the lifestyle. So, what kind of a lifestyle, like see more and more civilization, globalization, all that would lead to like modernization of our activities. Like we get to socializing activities, like we may consume alcohol, we may consume tobacco related products, and sometimes females they also sometimes they consume the hormonal agents that related to fertility or even childbirth, and or even for that matter even the family, as a family planning issue, they may be exposed to all this risk factors. So that is one reason. This is in particular about even the
doctor, can I interrupt in between?
Yeah.
Doctor, does it mean that the use of even the birth control pills by women, by a mother, for this one family planning for the birth control, can this be also a cause of this breast cancer?
Yes, partly yes. I am not saying that the birth control pills cannot be used totally. No. See, overabuse or overusage of the hormone,
of
yes.
the pill.
Yeah. So that means overexposure of the hormonal environment in a female body would lead to the breast cancer as a risk factor. And I was about to say, like in the lifestyle part of it,
yes,
it is also like consuming the junk foods, especially fat rich food. That is one of the risk factors causing obesity or overweight, what we call as overweight. That is also a contributory factor to the causation of the breast cancer.
Fine then, doctor, then let's talk in brief about the risk factors of breast cancer. Which age groups are prone to? What type of the breastfeeding, the lactating mothers, or can it be the, you have also mentioned about the genetic factors and all. Besides that, actually which group of ladies are really prone to this breast cancer?
Normally, like the middle-aged women, they are more prone for breast cancer, even though the dictum or the principle is that with the advanced age, cancer incidence also increases. But particularly so in breast cancers, it is the fertility period. It is the fertility period that is linked to your hormonal exposure. For example, we say early menstruation,
early
menarche, that's what technically they call early menstruation, and late cessation of
menopause.
Yeah, that is menopause, late menopause. So that will expose the female gender, our Mahila, to a wider period of exposure to the hormones that are secreted within, leave alone the external hormone that we are talking about. So early menarche, late menopause, both of them are essential to the risk factors for the breast cancers. And the parity, like nulliparity again having no children is also a risk factor for this one. I am not saying that if you have too many children, well, it is going to prevent the breast cancer. Not so.
Not
Yeah,
so.
well, there are studies saying that more than 2 childbirths is also a risk factor for development of
2 child
breast
is
cancer.
a SIP.
Yes, yes.
Is a SIP number. Fine then. Doctor, let's talk about the diagnosis. What are the early signs and symptoms of breast cancer so that one can know of it and one can know that if these are the signs and symptoms, it's the time they go for diagnosis so that treatment can be started as early as possible?
The earliest symptom will be some kind of lump in the breast. That's not disappearing. Sometimes lumps might occur during the menstrual period, but at a later time, once the menstrual cycles they regulate and they cease, well, the lumps might disappear. So persistent lump in a breast, breast is a very soft and a pendulous organ. Well, if you find a lump in the breast that is which is existing for considerable number of days, is an early sign of breast cancer. Not alone the breast, we have the armpits. The breast cancer, it doesn't stay there alone. They will spread locally, but also it will spread to the other areas, like especially what you call as the lymph nodes. So the lymph is a liquid that drains into that one. Ultimately, that gets into circulation. It is some kind of a cleansing mechanism, I would say. So similarly, this cancer cells, they travel through that lymphatics or the lymph channels, lymph ducts, and end up in the lymph nodes or the stations. They are called axilla or the armpit lymph nodes. From there, they will spread to different parts also. It's not just spreading through the lymph channels or the lymph duct, it can also spread through the blood as well. Okay. Well, the other areas where the breast cancer could spread, in addition to the local spread, it can spread to the lymph nodes, it can spread to the lungs, it could spread to liver, it could spread to the bones, and it can also spread to the brain. These are the areas.
Even to the brain?
Yes, yes. This is the basic spreading stations, what do you call as metastasis. Meta means many. Stasis means where they are stationed. So they can go and stay there. So that is metastasis.
Very well explained, sir. Sir, then let's talk about some facts and figures. Means in this particular year, 2020, what is the exact figure that's regarding this breast cancer? How many patients? Can you please explain about that?
Yeah, let me just touch about the overall incidence of cancer as a whole in our country.
Yes.
Like there will be this year, in 2020, they have diagnosed about 14 lakhs cases. A
very high number.
Yes, and unfortunately, so the prediction is going to be a little higher by about 10%, which is a large number. So it may spread up to 15.7 to 16 lakhs by the year 2020. That will add on to the health burden of our nation.
Which is actually not a good news.
Yes, yes.
So, doctor, let's talk about then I would like to know about the stages of breast cancer. How many stages of breast cancer are there, and after which stage is considered as successful treatment?
Well, to answer your question, like there are 4 stages. There are 4 stages. Stage 1 is the earliest one. Stage 4 will be the very late kind of a stage.
Late stage.
The first is two stages up to stage 2. To some extent, stage 2A, B, they are all considered early breast cancer. That means they are not spread elsewhere. The stage depends upon the spread of the disease. Supposing if it is spreading to all other areas other than the breast, the stage also increases. Well, early breast cancers have a favorable outcome because they come early treatment is possible, and early clearance is possible. So that will have a cascading effect on the overall survival or longevity of the breast cancer patients.
And then doctor, regarding treatment, the treatment options, let's talk about the treatment options. What are the treatment options we have now? We have heard about chemotherapy, even we have heard about immunotherapy, and lots of things are here. Let's please explain about the treatment options one can have regarding breast cancer.
As we have been discussing, the foremost treatment will be the surgical ablation. Ablation means, the removing the cancer by surgery. Well, the next thing comes like radiation, and also the medical oncology or the chemotherapy, hormonal treatments, biological treatments. All of them form the group of the multimodality treatment, that is the standard of care now. Not that one particular specialist doctor treats this kind of cases, for that matter any disease, but more particularly so in breast cancers. Like, for example, I am not saying that, straight away you go to the surgeon and get your breast removed. No, not that way. Like, the recent trend is that, what they call cytoreduction. Cytos means cells. A group of cells will form a tissue or a tumor. Tumor also comprises of a group of cells. Okay? The cell burden could be decreased by some interventions. That could be medicine or radiation. So, if we give medicine, that is called anterior chemotherapy or adjuvant chemotherapy, neoadjuvant chemotherapy, new adjuvant chemotherapy. If you give that few cycles, maybe 1, 2, 3, 4 cycles we give, and then the tumor will shrink.
Okay.
That time, if you send it to the surgeon, he will find it easy to operate. And the systemic spread, it would have actually, cancer is supposed to be some kind of systemic disease, I mean, given the latest day concepts. So, surgeons can remove only that part. Surgery will take care of only the local area. Radiation also will take care only that area, barring certain circumstances. Whereas the chemotherapy will circulate to the entire body and remove the peripheral cells as well. And it can reduce the bulk of the tumor. And that gives the surgeon the comfort to remove it, more clearly. What they call as margins. Once you remove, the margins should be free. That should be normal. So, that kind of a situation can be achieved by administering chemotherapy prior to surgery. And it does not stop there. Well, after the surgery also there will be some spill. So, that will be taken care, or some micrometastasis called. Still some tumor circulating cells or the cancer cells will be there in the body. That will be taken care after the surgery. That is called as neoadjuvant treatment. That could be like a chemotherapy, also followed by radiation as well.
Okay. Then, sir, you have talked about this kind of the part of the particular organ, that is the breast. That's what you called mastectomy. So, besides, I think I do believe that for a woman, breast is a very important organ, especially for mothers who breastfeeds her baby. So, is there any other treatment option? You have also explained a little bit about that. Can you go in brief about other option besides mastectomy?
Well, breast conservation surgery is one thing, like, we try to conserve the breast. The other thing is like, reconstruction of the breast. The only problem is, like, fortunately, most of the breast cancers, they occur on one side. So, the other breast is there. Still, it forms the cosmetics of a breast body, I mean, the woman's body. So, reconstruction of the breast is possible. The other thing is, like, and the breast conservation would not essentially mean by, surgical part, taking flesh from one area and putting onto the breast and then reconstructing it. That is not the only option. But, we have hormonal therapies. Well, if the like hormone dependent cancers, well, hormonal manipulation is possible without even having to remove the breast cancer.
So, you mentioned one very important, one interesting point, hormonal dependent cancers. So, what are those? Please explain in brief.
Well, normally the breast is a hormone dependent organ. Even for the development of breast, hormones are essential.
Very true.
Well, you have estrogens, progesterones. These are the principal hormones that are responsible for the normal growth of the hormones. Only when they become aberrant or overproduced, when the cells grow in abundance, that time we need to control the hormones. So we give medications to control the hormones or to deplete the hormones. There will be anti-estrogens or anti-hormonal therapy. So several such classes of medications to achieve the hormonal control is available now from the present day. Several of them.
Fine. Sir, I was asking about hormonal dependent cancers. What are the other types of cancers besides breast cancer?
Well, the other ones, essentially, it's by which are the organs that are producing hormones are important.
Yeah, very true. Well said.
So, in the male gender, this will be prostate cancer.
Prostate cancer.
And both genders combine together thyroid.
Common in both the
yes, both the genders,
both
thyroid
genders.
cancer, of course breast. So these are the essential, and then of course ovaries, they also produce hormones.
Ovarian cancer.
Yeah.
Then doctor, how do one prevent herself from getting breast cancer? What are the preventive measures one can take regarding breast cancer?
Well, you have to concentrate on the family history, one. Number two, screening procedures that are very, very important, see, breast cancer screening can be done from at home, sitting at home. All that you need is to do a self-examination of breast. That's so easy. You don't require a physician or a nurse to come and do the self-examination. We could do it.
Self-examination.
Self-examination. Supposing anything abnormal coming,
any lump,
then possibly they can go to the nearest doctor and ask for now the mammography or imaging of the breast is possible. So there are different types of imaging. They can image. That's a soft X-ray, because breast is a very important organ. No organ should be exposed to excessive radiation, because that itself is a cause of cancer. So they have a specialized low radiation technique where the breast can be imaged, and that can bring out and diagnose breast cancer. Self-examination of breast and the mammography part of it. Then of course, you look into your own family tree, your family history. Somebody has breast cancer, the mummy or grandma or aunt even, maternal aunt, paternal aunt, anybody having a breast cancer, you don't ignore them because they only had it.
I have to interrupt in between. One phone call is there. Yeah, let's
pick
up the phone call. Hello, HAKSHELGI PAOJEL ne haibiyo.
Good evening, madam.
Good evening.
I'm calling from Biswarjit, Morang Mayai Lekai.
Yeah. Please ask your question.
First, sir, tell me the warning sign of breast cancer. The next question, what is usually the first sign of the breast cancer?
Oh, the signs and symptoms of breast cancer.
Thank you, sir.
Signs.
Sir. Yes, sir.
Yeah, thank you for calling. Call the Wirapayam Noise Thagachare Dombo. He is asking about the first early signs and symptoms of breast cancer.
Well, that would be the...
Yeah, sir also have mentioned earlier before.
Yeah.
I think he wants to know a little more detailed about that.
Yeah.
Regarding signs.
Yeah. And the second question was...
actually, network was not that too good, and I just can't note that the first signs and symptoms of breast cancer.
Okay. Well, as I said, a lump, a persistent lump that is not disappearing.
Yeah, please, sir,
that will be
the signs.
First sign of breast cancer, and some kind of a discharge. Abnormal discharge. It could be, it need not even be a bloody discharge through the nipple. It could be even a fluid discharge from the nipple is also an early sign of breast cancer. And by and large, mastalgia or the pain in the breast is not very much associated with breast cancer unless in a very advanced stage. So a lump, any kind of an abnormal discharge from the nipple or the early signs of breast cancer in that group, age group.
Thank you, doctor. Then, doctor, there's another phone call. Yeah. Hello, HAKSHELGI PAOJEL ne haibiyo, wahang hangbiyo.
Good
Hello.
evening, doctor.
Yeah, good evening.
Good evening, madam. My name is Bipin Warivan from Langbam Nakai.
Yeah, Bipin,
And
you
my
can ask
question
your
is-
question.
What are some types of breast cancer? Please give me my simple question. Thank you.
Types of breast cancer. Thank you for calling, Bipin. Doctor is asking about the types of cancer. Doctor, yeah, please explain about
Okay.
the types of cancer.
Yeah, thank you, Bipin.
Yeah.
There are essentially the breast cancers occurring within the breast, that is called as a primary breast cancer. Okay. Well, the breast consists of different parts of the gland. Essentially, that's a gland, and a gland that secretes the milk, and it has got a glandular tissue, and the milk is carried through a duct. Okay, that is called as a duct. What do you call as a mammary duct? So, it could be grossly that is called as a mammary cancer. Okay. Ductal cancer is one of the commonest varieties. Duct, the one that carries the liquid in the breast is called a duct. So, ductal cancer is one variety. Other one is the lobular cancer that arises from the gland part of it. So, these are the two ones, and the glandular part is little difficult and more aggressive kind of a cancer. Ductal cancers are fairly acceptable. I am not saying acceptable, but clearly treatable kind of cancer.
Treatable, successfully treated.
Yes.
Can be. Then, doctor, we have another call also. Hello, HAKSHELGI PAOJEL ne wahang hangbiyo.
Yeah, I just want to ask one question to the expert.
Yeah, please.
Expert stated that menopause is relating with the breast cancer.
Okay.
So regarding this matter, what is the average age of menopause and what about the age of that late menopause? I just want to know this one. And the second question I just want to ask, then what are the precautions we need to take if suppose I have that late menopause? Then what are the precautions we need to take? So I just want to know these two questions from the data.
Thank you. Thank you for calling. Thagachari call to Birakpa Dumbo. Yeah, doctor, the first question was about the relation
Menopause.
between the menopause and the breast cancer. Yeah.
Okay.
Yeah, let's answer this first and we will come to the second question
Okay.
later on.
Now, the menopause, age of the menopause, it varies, it varies from ethnicity and different age groups. The menopause could be normally the when you are having the menarche or the menstruation, that is called as a premenopausal phase. Okay. When it is about to stop, it is called perimenopausal phase, where there will be irregular menstruation. Ultimately, that will stop. Once it stops, year after that, it is called as a postmenopausal period. Okay. Well, you asked about a particular age of menopause that that varies between 40 to a larger extent, it could be up to 55 years.
55 years.
Yeah, 40 to 55 years or late 30s, I would even say 38, 40 until 55, 58 years. That will be the age for
Considered as
menopause.
yeah. Okay, then doctor, the caller's second question was about precaution. If a lady had this one late menopause, then what can she do to prevent herself from getting breast cancer? The precaution that one can take regarding late menopause.
Well, this is there are studies saying that it is ethnically and then genetically controlled. There are not specific kind of medication or the other that could stop the menopause. Having said that, I have to say that supposing it is getting prolonged, the other option could be like medical menopause or a surgical menopause. That would be like suppression of the ovarian hormones by drugs or even simply by removing the ovaries. Some centers they practice this, supposing the menopause is going to be prolonged.
Then we have another call also, doctor. Yeah, let's take it. Hello. HAKSHELGI PAOJEL ne huang hang bio. Hello. Hello.
Hello.
HAKSHELGI PAOJEL ne huang hang bio. Hello. Yeah, please ask your question. Yeah.
Morang Kampu.
Yeah, please.
If there is risk of breast cancer to the child, please don't note that mother needs to their childhood.
Hello. Can you please repeat your question, Mr. Sharad? Hello. Yeah, the network was, the line was not that good. I can't hear it properly also. I think it was not that clearly audible. Can you get it, sir, from the caller?
No.
Yeah, me too. But I think, but I think he wanted to know about a mother if gets breast cancer, then about the chances of getting cancer to her babies, somewhat like that. I can't get it properly.
Yes,
if that is the question, what can be the answer, doctor?
Well, if mother has a family history of a breast cancer, the child getting a breast cancer is close to 25 to 30%. So, at the appropriate age, well, they have to be screened for the breast cancer. That would be like different types of, imaging the breast, also the self-examination that to start from the age of 25 onwards.
25 onwards.
Yes.
Well explained, sir. Doctor, then doctor you have mentioned about hereditary factors. You have mentioned about the first degree relatives, second degree, and then even the third degree relatives. What are the chances regarding first degree, second degree, and third degree, the chances of having breast cancer? Please explain about that in detail.
Yeah, closer the inner circle in the family, family tree for that matter, the chances are more. There will be increased, risk for developing a breast cancer. Of course, there are, genetic analysis that is available or genetic testing that is available. What they call as a BRCA, breast cancer, BRCA. BRCA.
Okay.
If that is done, that will give us an idea how close are we to get a, how risky are we to get a breast cancer. Unfortunately so, the genetic testing, in a developing nation, well, it is going to be expensive. There again, one small information, but we need to know is that, the BRCA testing will give us an indication about close to only 10 to 15%.
Okay.
So there is a question of cost-benefit analysis. More, studies need to be looked into when we want to, forcibly say yes, you need to have this BRCA testing or other.
Okay.
But it is desirable.
Desirable. Okay, fine. Then, doctor, next I would like to know about what are the initiatives being taken up by the government to handle this cancer burden in our in our country.
Yeah. Both Kendra Sarkar, both central government and the state government concerned, they are very concerned about the cancer burden in the respective states, more so in Manipur.
1 second, doctor. Yeah, that was very interesting topic, but one phone is already waiting for us. Let's take up the call. Hello? Hello?
Hello?
Yeah.
Hello? Hello?
Yeah. Wahang Hangbio, please ask your question. Hello?
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 Yeah. Wahang Hangbio, HAKSHELGI PAOJEL ne Wahang Hangbio.
I'm from, my name is Babina, and I'm from Cooperative. I just want to know that what is the symptom of breast cancer?
Symptoms of breast cancer. Okay, thank you for calling. Actually, doctor, you have briefly explained about the symptoms of breast cancer, and our caller, means our viewer, may have watched the program a little bit late. Can you please repeat that?
Of course, yes.
In brief,
for
the caller.
The symptoms of the breast cancer will be like, a lump, a persisting lump or a small swelling in the breast, okay, which is not disappearing with conventional, treatment. That is one thing. The other thing is like abnormal discharges from the nipple of whatever nature is also one of the early symptoms of breast cancer. These have to be certainly looked into and then subjected to examination.
Yeah, well explained, Doctor. Doctor, we have been discussing about the government initiatives. Yeah, you can continue, please, about that.
Yeah, well, as far as state governments are concerned, there are especially the Chief Minister's Health Relief Funds. Well, it allows up to 2 lakhs per family unit to be spent, and essentially that includes the cancer care also. And everyone should utilize this particular opportunity to get to know the empaneled hospitals, and then avail this free initiative that is extended by the kindly extended by the state government. And if you get into the central assistance or programs that are available, you have the Prime Minister's programs, PMJY, the Pradhan Mantri Arogya Yojana. So that allows up to 5 lakhs, and interestingly so, this allows cashless transactions from the empaneled hospitals, including it does not have to be necessarily hospitalization. It could be done on outpatient, like even for investigations like your CT scans or a biopsy.
Diagnosis.
Yeah. So cancer related diagnosis, all that could be covered. And
under this plan.
Yes. So this is up to 5 lakhs. That is
a big amount.
Yeah, good, fair enough amount for anyone to avail. That's one thing.
Very true.
I also want to add, like even travel concessions are available for the cancer patients. The not alone just the cancer patients, but also for the attenders. They can, one of the attenders
even for the attendants.
Yes, they can travel. And if I remember correct, this is also available in the air travel as well.
Air travel as well.
Yes.
That's a good news.
Yes.
For the people of
Yes.
India.
Yeah. So everyone should avail this. And there is if you go to the railway station, the counter, etc., where you must say that all that you need to say, give an evidence that you are suffering from cancer. That's hospital discharge summary or other. They give you straight away the concession, and then you can well avail that. And apart from that, we are not we cannot just depend upon the state run or state offered funds only. We should make our own initiatives. I am not saying that we have to spend so much of money and invest so much of money on this kind of thing. But then if you look into the current trend, leave alone the cancer, even the other diseases, well, there is a private insurance. That one, everyone should attempt doing it.
Yeah, very nice suggestions. Thank you for that, Doctor. And then, Doctor, we have also heard that somewhere, I have heard that mammogram is not a very healthy option for a young breast, for a young lady. So, Doctor, is there any other diagnosis option besides this mammogram, which is little more healthier?
Very interesting. And
can I say more healthier?
Yes, yes, yes. Well, as you rightly said, that mammogram is an exposure to X-ray. That's what you mean, right? Yeah. Well, see, this is a low dose X-ray that will not harm. Just like in the airport, your baggage is screened. Well, you are also screened. That's also low grade X-rays.
Yes.
That kind of thing is there. That's being offered in imaging the breast. That's one thing. There's one other thing that's called a sonomammogram. That is ultrasonography or a sound imaging of the breast. Especially, we a few times we come across young girls coming with breast lumps. We cannot expose them to the X-rays. Even the mammogram, even though how low the dose could be, they cannot be exposed to radiation. At that time, they do what they call as a sonomammogram or a sound imaging of the breast. That could be done. In addition to that, there are other options like magnetic resonance imaging mammogram, MRI mammogram. That could also be done,
Perfect.
where there is no radiation involved.
Okay. Then doctor, I think stress is also an important factor to a breastfeeding mother. Then can stress be a reason for this one getting breast cancer?
Stress is a common denominator for almost all diseases.
Very true. Well said.
Yeah, there's one thing called as a mind over matter phenomenon, where the mind is restless and then it is disturbed. That will alter the interior or the internal environment of the body. That is where the yoga comes into play, where resting, controlling, resting the mind. And that kind of a concentration will help, quell or diminish our anxiety, and in turn the breast cancers as well.
Thank you. Then, doctor, those ladies who are under medication for the treatment of breast cancer, if like they have done their treatment, they have done mastectomy, then for those ladies, what can they do for herself so that cancer doesn't get they didn't get the cancer again? The self-care they can take for their so that cancer doesn't get back to them again.
Actually, like there are controlled studies, or there are studies saying that each cancer has got survival with or without treatment. Okay, they call it as long-term survivals, like 5 years and beyond, even more 10 years and beyond, all that. Well, how the recurrence part, well, they go for regular checkups. We call them for regular checkups, like so depending upon the type of the cancer and the type of growth of the cancer that is identified by your histology or the microscopic examination. They call us Ki index, the rate at which the cells grow. So that will form an idea about how the growth is happening, what is how the cell growth or the cancer is growing. So that will give an indication, like how frequently they must come for this one, and they must periodically come for screening the areas, not alone that primary area where the cancer occurred originally, but also on the other sides. There could be peculiar circumstances where the cancer first occurred, that part will be free from cancer. You will find cancer somewhere else, for example lungs, liver, for example stomach cancer,
it
or
will not
colon
occur
cancer.
at the same part.
No, it need not occur in the same part, it could come in some other part. So those are called as a susceptible areas of spread. So when you are screening or re-examining a patient review, when you do the oncological or a cancer review, all these areas have to be seen. And most
doctor,
recently,
I have to interrupt 1 second, another phone call. Yeah. Hello, HAKSHELGI PAOJEL, wahang hangbiyo. Hello. Hello.
Hello?
Hello. Hello. Yeah, you can ask your question, please. Hello.
Hello?
Yeah, hello. Tazari, wahang hangbiyo, HAKSHELGI PAOJEL ne. Hello. Doctor, the network was not that clear. We couldn't get through the line. So yeah, please continue about the conversation you have been explaining before. Yeah, you have explained before the phone calls. You can please explain about those.
Yeah, it can the cancers can happen in the other areas, leaving the primary area.
Leaving the primary areas.
Yeah. So in that case, well, we target the organs, various organs, of course, including the primary area where it originally occurred. That's one thing. Interestingly, like there are some radionuclide studies. It is given in the form of an injection, well, that circulates to the entire body, and then that can find out the activity, the so-called cancer showing up or hiding somewhere, that could be found out. This is called as a metabolic imaging, PET CT scan. That's available. It's very much available in Imphal.
In Imphal itself. Okay. That's a good news. Then, doctor, can we know more about some topics regarding psychosocial aspects of breast cancer?
Well, this is called as what is called as a support group, like a cancer patient, depending upon the age group that they are in, they get into some kind of an aloofness, like they don't mix because they think it is a myth. We are suffering from cancer. Cancer, all of us know. I would like to again reiterate and say it is not an infectious disease. It doesn't spread from one person to the other externally. Okay, all that they need to know is to live with the cancer, and the disability caused by the cancer treatment. Maybe it is mastectomy or some other ablation, etc. They have to live with the cancer. That is one thing. Number two, there are groups called as support groups. Like the cancer, the patient themselves, they mix with each other, and that group in turn mix with the normal population. So they are one among us. Just like there's no stigma about cancer. No more. No more. We had tuberculosis or stigma, leprosy, stigma. It was all there. It's no more. So cancer also should fall into that category. And they must try to live with the cancer, and the activity as much as tolerated. I would even say the great celebrities, they've undergone mastectomies.
The celebrities.
Yeah. Many of the movie actresses, they've undergone this one. And men do not have to be complacent, because they are also prone for breast cancers.
Even
the
men also
yes,
for
male breast
cancers? Okay.
That is more difficult to treat.
Okay.
They are very aggressive.
What is the rate, present rate, this one, male getting breast cancer?
Yeah, 0.1%.
It's very low.
Very low.
Very low.
Sure.
But they can get.
Yeah, I'm not threatening anyone.
Okay, yeah, fine. Okay. Then doctor, let's talk about working women. Those working women who is breastfeeding, who has a little baby at home, who can't breastfeed their baby on time, then what is there any risk factor? Is there any risk for them to get breast cancer because they can't breastfeed their baby on time?
Like the maternity leave has been extended now.
Very true.
Yeah. So that is to allow the the breastfeeding mothers to go home and feed the children. They are at home, they can feed. Even in the some of the industrialized nations, when they have this kind of a breastfeeding mothers at work, they have specific breastfeeding areas in the workplace where they can breastfeed and then send it. And of course, foster mothers are the other aspect. The other thing is, like, we need to realize that stagnation of milk in a breast is not it is a healthy practice. Or they have a breast pump, then exposed, and they milk out the breast so that there's no stagnation. That will help the breast health.
Okay. Then doctor, besides women, what is the most common type of cancer that the male genders have nowadays?
Well, it is in our part in particular, I would say it is lung cancer, which are more. Nationally, if you see, lung cancer is also among the male gender, oral cavity, lung cancers, and your stomach cancers. Stomach and colorectal cancers are the large intestinal cancers. These are the common ones among the male. Particularly in this part of northeast, in Manipur or the nearby states, a complex, great northeastern part of our country, nasopharyngeal cancers are common. Nose and pharynx combined, especially in the nose cavity, nasal cavity, those cancers are very common, which we don't find in the southern parts of our country. Interestingly so, there is one other one, like that's why unity in diversity.
Unity in diversity.
That's
Very
the
nice
crux
sentence.
of our, our culture, the Indian philosophy and culture. So likewise, we have different ethnic groups. No single Indian is the same as the other person.
Very
that's
true.
different. But all of us, live as brothers and sisters. Well, That applies to this particular disease as well. I'm sorry to say that. Well, different areas, they have different ethnicity, and depending upon the ethnicity, the cancer pattern also varies. That's why there are several cancer registries where they register the cancer cases. Different cancer registries are there in different parts of our country. Each one registers, their own, cancer incidents. So they are trying to pull up and then give a common kind of a ranking of the cancers. To answer back to your question, among the male, it is lung cancers, the head and neck cancers, grossly called as the mouth cancers, the tongue cancers, or a gingival cancer, pharyngeal cancers, or laryngeal cancer, all of them as a group as a head and neck cancer. That one, these are all tobacco related. I told you, like 40% of the cancers are related to the tobacco abuse. So cessation of tobacco, time and again I would say yes, it has to be done. That's why majority of the states, they have legislated, anti-tobacco laws, by way of increased cess or even total cessation of the tobacco products. It's not just essential that you keep smoking. Even if you are there among a group of people who are smoking, you are at risk, equal risk for developing cancers. That's called as a passive smoking.
Passive smoking.
Yeah. These are basically, important that we need to, think. The modification, a healthy lifestyle, exercise, and preferably low fat diet, more fiber diet.
Doctor, before we go in detail about the diet, there is another phone call. Yeah. Hello? Hello?
Hello. Can I ask to our doctor that?
Yeah, please. Your question, please.
Yeah. Which age of a particular woman
Yes.
have
Please
a breast
continue.
cancer?
Repeat your question, please.
Yeah, the particular age, the breast, the cancer, the formation of the cancer.
Particular age. You are asking the age. Doctor. Thank you for calling. Thanks for your call. Doctor, he's asking about the age group, risk factors, the age groups.
Well, it is basically the middle age. It's in middle age. They are, more prone for the development of the cancer. Even though advanced age, there are different type of cancer, but especially in the female gender, it is the middle age. They are more prone to the breast cancers.
Okay. Then, doctor, like you have been explaining about the diet one should take to keep oneself healthy, free from cancers and all. Yeah, you can continue that.
Well, I said the fiber-rich diet.
Fiber-rich diet.
Yeah, fresh vegetables and fresh fruits, not the canned ones and then stored ones, or preserved ones, without preservatives. And preferably, organic farming is nowadays taking, good shape, and that kind of an organic food that will be, more preferable and then advisable and then healthy
option. Yeah. Then, doctor, do you think that counseling will be helpful besides medication to a person having this breast cancer and all?
Yes. Whoever has a breast cancer, I have seen a few people coming late. The reason being, they have the hesitancy to come out when they have, because basically these are organs of particular importance and particular, gender specific organs, and which are not very much exposed as well, because become in tune with our culture, So what I am advising and then suggesting that never be hesitant to come out when you have a breast cancer. Say, yes, I have this kind of thing. Go to a doctor, be open, come out, and then come and then get yourself examined so that it could be detected early, and then ultimately it will lead to the cure of the breast cancer. And cure of the breast cancer, or perhaps treating it, and then by offering a reasonable quality of life, will also help our nation to develop our manpower initiatives.
Yeah. Doctor, we have come to the end of today's program. Any message you would like to leave regarding the breast cancer topic to our viewers?
Yes. Well, awareness very important. Get to know. I mean, when we are watching regular movies and things like that, spend some time into the early diagnosis, early presenting symptoms of the breast cancer. What are the preventive or screening programs that are available? What are the financial resources and the technical resources that are available before us to access them? That is one thing. Not alone that we know for ourselves, we must spread this message to anyone. That is the early detection, early diagnosis, early treatment, will cure you, and I wish everybody the best.
Thank you, Doctor. Thank you so much for being here. Besides your busy schedule, I really appreciate your time. Thank you so much once again. Ngasigi hiram breast cancer asiga mari leinaba wafam sing adomna phongduk pirakpa kaubigano. Aikhoigi address ti to the Director, Doordarshan Kendra Imphal, HAKSHELGI PAOJEL, Porompat 795005, telephone number 9436202703. Ningthokaba amasung irai khudingi numidang wairam pung manga makhaida sandokchaba HAKSHELGI thoram yengbiba kaubigano. Thoram yengbiriba mayam pumnamakpu amuka hanna khurumjari.